Welcome to Haggard Equine Medical Institute. The clinic today, known as Haggard, was actually started in 1876 by Dr. E.T. Haggard. He was summoned to Winchester, Kentucky from Canada to look at a bull named the 8th Duke of Geneva that at that time was worth more than 10,000 gold coins. So when Dr. E.T. Haggard came down to Winchester, he realized there was a great need for veterinary care in central Kentucky, so he moved here and started his practice. The reason that's so significant is it makes us one of the oldest private practice equine veterinary clinics in the world. And another really interesting piece of our practice is we've always had a Haggard family veterinarian working here. We at Haggard, we're also one of the largest private practice equine hospitals in the world. We have over 50 veterinarians on staff to assist our clients with any needs that they may have. We have the Haggard Field Care Division, the Davidson Surgery Center, the McGee Medicine Center, the McGee Fertility Center, and the Haggard Sport Horse programs, in addition to a full-service pharmacy and a Haggard laboratory.
All right, so what we have here is a 5-hour-old foal that was born in emergency C-section because its mare had perforated a portion of her intestinal tract due to colic. When she arrived at the clinic, she was colicky, and we went straight to surgery. And at that moment, we knew they found a perforation. When you have a perforation of your intestinal tract in a horse, the prognosis is poor. So because you got intestinal content within the abdomen, and that's feces, and the animal will get toxic, will create adhesions, and just won't live a good quality of life, period. So we had to euthanize the mare and do an emergency C-section before we euthanized the mare and got this foal. This foal was premature, and due to the septic nature of the mare being extremely sick, we had poor perfusion in utero to this foal. So poor perfusion means poor oxygenation, poor blood flow, and hence we have some brain injury, that caused this animal not to breathe, so we had to put it on a ventilator for the last 5 hours. We have just weaned it off the ventilator, so it's taking breaths for the first time by itself. And what we need to watch for it does not get fatigued, and that it can ventilate itself well. Because these lungs could be premature, which means we'd have to put it on a ventilator and discuss the owners with the prognosis. Because usually if you have premature, immature lung, they can be on a ventilator for quite some time. It can be anywhere from days to a week or weeks, and the prognosis can be poor due to sometimes you get ventilator pneumonia. The cost aspect of it can deter clients from going that route. So as soon as you put an animal on a ventilator, the goal is to get them off the ventilator as fast as you can. So we did pretty well for 5 hours. And now we're just assessing the patient. So you can hear his lungs. His lungs are very tubular, so we just got to really watch the way he's ventilating. And just do the best we can. Let me see.
Okay, so this is a standardbred mare that came in as a dystocia, and she had to have a C-section in order to get the foal out. The foal is what we call has a dummy syndrome, so they don't have a lot of the basic instincts that foals should have, like nursing and getting up and doing all the sort of normal things. So we have to teach them how to nurse. This is a maiden mare as well, and she has not really bonded to the foal, so we have to be careful about bringing them together, restraining the mare, and hopefully over time she will end up bonding with the foal, but right now she is dangerous to the foal. So we, in between treatment periods when we're trying to get the foal to nurse, we put them in the gates to keep the foal safe. And the mare is able to smell the foal and be with the foal, but not be able to hurt the foal. So we are treating the mare as a patient as well, and the foal is here. We're NG tubing, nasogastric tubing the foal while it can't nurse on its own to supplement for nutrition, and It's getting IV fluids as well. And then the mare has to be treated with the C-sections. They need abdominal lavage regularly to treat the abdomen from the C-section from being opened.
So this is the neonatal ICU. We see approximately between 250 and 300 neonatal foals come into this unit during a season. Our busiest season is from January to June because we see the majority of what we see are thoroughbreds, and they foal in the spring for the most part. By June it's pretty much finished, and we'll close this barn down until after Christmas again. The criteria for coming into the neonatal ICU is you need to be 2 weeks and under. So we'll see all babies in here. We have a separate unit for high-risk foaling mares and a different barn. Some of the diagnoses that we see in the ICU are angular limb deformities. We get a lot of contracted foals. We'll see premature foals. Foals that are septic. We'll see a lot of foals that have maladjustment syndrome or PAS, where they are hypoxic at birth, and it will make them kind of delayed. They don't understand nursing, or even sometimes they need help to get up. We see also some neonatal isoerythrolysis or NI foals, and along with a lot of other diagnosis in this barn. This is very intensive care in here. It is the most intensive care in the whole medicine department. Our ratio of technicians to foals is approximately 1 to 3. We do have 30 technicians for the season working in the medicine department, and a majority of them are doing a 6-month internship. So they're here from January to June, learning about neonates as well as everything else in the hospital in the other barns. So our biosecurity protocols are very strict in the clinic. We don't share anything between horses, from the tools. As you can see, every tool, rake, broom, and fork are individualized for each specific stall. Everything is color-coded. Every stall has its own hoof pick, its own brushes, stall side carts. Everything is separate to prevent cross-contamination between patients. Our stalls in our medicine department are equipped with in-house oxygen, and all of the stalls in the neonatal ICU have oxygen available at each stall, in addition to a fluid hanger. A lot of our foals are on Tempur-Pedic mattresses to prevent bed sores. So if they're recumbent, they'll be on a Tempur-Pedic mattress in with the mare, which requires a lot more nursing care for a recumbent foal. A lot of what you see in human nursing, you'll also see in the horse hospital. Everything from oxygen to total parental nutrition. This foal is on TPN, which is like IV food, and we have, fluid pumps for specific amount of milliliters per hour. A lot of our foals have urinary catheters in as well. So a lot of people do compare us to human hospital or children's hospital as far as the level of care.
Okay, I arrived from Australia in January. I found out about the internship at Hagyard's through looking on the internet. I wanted to come over to the States just to get some experience in an equine hospital, and I found this and I applied for it and I got it, which was wonderful. So I've been here, like I said, since January. I've learnt so much. My brain is in overload almost, and I'm really happy that I can take all this knowledge home with me and use it at home when I go back to the clinic that I was working at. Probably I work in a small town, so it's nothing quite as intensive as this, but it's a very valuable experience.
This is our high-risk maternity ward for mares that have the potential to have some sort of issue foaling. So if we think we're going to have a problem, they would be in this barn. We'll have one technician monitoring 24/7. If a mare has had a previous issue with a foaling, if she's had a fractured pelvis, if she's had previous problems with placenta previa, if she's really overdue, or if she has some issues perhaps with a known placentitis, or we think the baby's going to be sick, she would be in this barn where we have everything ready to go. It's fully equipped with in-house oxygen. Our foaling mare cart is here with everything needed for resuscitation for the baby. And we, of course, take care of the mare as well. So this barn stays pretty busy during the spring when the babies are hitting the ground. And we find it to be great and contained under one roof where we can watch everybody very closely.
I am Imogen Cummin. I'm one of the fellows here. I'm a veterinarian from England originally, but I've been working in America for about 2 years, I think. I came to Haggard's last January to do a 6-month fellowship, and then I ended up staying for a total of 18 months, so a little bit addicted to the babies and the mares, I think. Ultimately, I'm moving on to do a medicine residency, so I currently work in medicine at Haggard's, and obviously that's been very useful with regards to my future. I wasn't sure if I was going to continue in medicine, but I decided to, having worked here and seen all the great doctors and the wonderful cases that we have. This is a brood mare that came in for abdominal pain or colic. She had a mesenteric rent, which is a hole in the mesentery, and a small intestine was trapped and had to be removed. So she was pretty ill, but she's doing really well. The foal, as you can see, is very bright, trying to escape, wants to go outside. And the mare is doing very well. She has a muzzle on, just because we're slowly reintroducing her to feed. She hasn't had any problems post-operatively, so that's good. And she has a belly band just covering her incision to keep it clean and stop the foal from licking it or playing with it or doing anything that they like to do, because they're a little wild when they're healthy. So, but they should be going home shortly, so that's good.
So this is the hyperbaric chamber in the Haggard Medicine Department. The chamber is used for a variety of things. In horses, I would say the most thing we would probably use it for are post-op colics, cellulitis, lymphangitis, osteomyelitis, radial nerve paralysis, post-op throat surgery. We've had dummy foals in here do really well. So it's used for a variety of things as an adjunctive therapy, and we found it to be really successful with a lot of diagnosis. The amount of time they would spend in the chamber would be about 1 hour and 20 minutes. So you would have to consider the cost as far as your patient and what your expectations are. We do have 3 board certified hyperbaric technologists on staff. Myself and Dr. Slovis are double boarded in hyperbarics in humans and veterinary, and Samantha Baker is also boarded. All of our technicians that run the hyperbaric chamber receive extensive training in San Antonio. It's a week-long training class to make sure we're providing every safety feature that we can. All the patients are seen by a veterinarian before they go in the chamber. We take their vitals. If it's a baby, we'll check blood glucose to make sure it's adequate. And then we'll come up with a protocol for how many treatment times we feel are needed. It's relatively new at Haggard's. It's been around about 8 years. In people, I think a lot of people don't realize in humans, hyperbarics has been around for over 300 years. So it has been proven to be effective as an adjunctive therapy for a lot of diagnosis. Very brief synopsis of hyperbarics. How it works is it forces oxygen to the cells by dissolving the oxygen into the plasma fluid, the cerebrospinal fluid, and the lymph fluid. So you're basically bombarding the cells with oxygen. And you get cellular repair, you get tissue repair, and it's sort of this cascading effect where it speeds up healing.
So this is ozone therapy. Ozone is a type of antimicrobial therapy, if you will. It's used to kill bacteria or to kill infections. So I have medical grade oxygen in the tank that's outside, and the oxygen goes through the machine. The machine adds a third molecule to the oxygen. So here I have a mixture of oxygen and ozone to clean it up, the infection that we have in this chest. The treatment takes about 20 minutes. It's very soothing. It helps with pain relief as well. But we use in open wounds or anytime you have an abscess. The ozone being a gas, it's nice because it gets to the smallest little openings and it really helps to clean it up from the inside out, allowing the wound to heal on the best time possible.
Here at the McGee Medicine Center, we have 4 doctors, all of which are boarded in internal medicine, as well as additional board certifications in emergency and critical care, and both human and equine hyperbarics. We average about 2,500 cases a year, with over 400 foals seen in a breeding season, 200 specific neonates. With Haggard's rich heritage in the horse racing industry stretching back for over 135 years, our veterinarians have looked after some of the most prestigious racehorses of all time, in addition to some of the most prestigious racehorses that are currently on the track. Thank you for joining us here at Haggard Equine Medical Institute. We hope you've enjoyed your visit of the McGee Medicine Center.